Hi, I'm Jasmine, the practitioner for Empower in King's Lynn. Over the last few months, since the pandemic hit, we've had to adapt our way of working dramatically, from quite a face-to-face service to a mainly remote one. Many of our service users have complex emotional needs and are generally very vulnerable. Risk factors for these ladies increased dramatically in lockdown, especially those that are at risk of exploitation, substance misuse, those that have variable mental health, and those that are in domestic abuse relationships. Ensuring these service users had the continuity of support they'd been receiving, and still making sure it was adequate for their needs without being able to give them face-to-face support had its challenges, but it also had its triumphs in a way. I've been supporting a particular lady since I started working for Empower about 2 years ago, and she's achieved some amazing things in this time, overcoming heroin addiction and coming to terms with multiple past traumatic events in her life with the help of really well scaffolded local support and some counselling that was actually funded by Empower. However, she has actually been in a coercive and abusive relationship for quite a few years and has really struggled to find the confidence to end the relationship and take that next step. A few weeks into lockdown, I received a call from this lady and who had decided, well, today was the day and she was going to end this relationship. I was instantly concerned at the thought that I couldn't be there for this lady in person and how I'd adequately support her in such a high-risk situation. Fortunately, this is where our collaborative work with the drug and alcohol service, the police and housing throughout our support of this lady actually paid off. With advice from Leeway, we were able to work together to get the perpetrator removed from the property by the police, secure her new locks for the flat and the entrance of the flat in order to safeguard the other tenants in the block as well, and ensure she had her ongoing support from the drug and alcohol service. This service user has now been able to reconnect with her sons, meet her newborn grandchild, and even eat out at a local restaurant, something she would have never ever done before. Thankfully, this isn't the only similar story throughout the Empower team. Although we have had some struggles in some aspects of this new way of working, as have our service users, I believe that Empower have provided exceptional support in exceptional circumstances. And COVID-19 has brought our team together from miles apart.